What is the ideal weight that somebody thinking about bariatric surgery should come to you?
I feel the weight is subjective according to the height, age, and everything. So what happens? Height is specific India. If your BMI, that is according to your height, you should be height in centimeters minus 100 is approximate weight. For example, you are 180 centimeters, minus 100 is 80. You should be 80. If you are 25 kgs more than your desired weight, you qualify for surgery. For example, you should be 80. If you are 105 plus, you qualify for surgery. Understand? 25 kgs more than the desired weight.
Okay, so my height is 176.
Yeah.
Minus 100 is 76
76.
kilo.
If you become more than 100, you qualify for surgery.
I qualify for surgery.
Yeah. Roughly, I'm talking about.
Yeah,
If you consider as BMI points, it will be like 32.5 plus.
Right. No, I don't need surgery. I'm just asking.
Yeah.
So more than 100 kilos. Let's say I was 100.
Yeah.
Okay. When I come to you, you're also going to encourage lifestyle measures of losing weight first. And I will try calorie control, sleeping properly, all those things. At what point of time I would say that, hey, no, I tried everything.
See, you are saying you were also 100 once upon a time. See, I'll tell you what is happening. Whoever is more than 25 kgs, I don't operate. They qualify, I'm telling. To do a surgery, this much BMI should be there. So, for example, who walks into our patient? For example, you said 100. If you're 100, you walk into my OPD. I'll do a body mass analysis. Then I will see a BMR. And I see a fat percentage distribution. And I see a visceral fat. Visceral fat is very important.
Educate again, what is visceral fat?
Visceral fat. There are two types of fats. One is below the skin, that is called subcutaneous fat, like this, when you see outside. Visceral fat is which is attached to your intestines and liver, that is called visceral fat. This subcutaneous fat is not dangerous. It may be cosmetic value. But visceral fat will cause all the diseases. Like whatever diabetes, blood pressure you're going to get is because of those visceral fat. We measure the visceral fat. The visceral fat should be less than 10. If it is less than 7 or 8, it's very ideal. So as Indians, we see a lot of central obesity. So visceral fat will be more around 10. So if the visceral fat is 20, then it's a danger symbol. Understand? And one more CB is ultrasound scan, check your liver. If it is grade 2 or more fatty liver, then definitely it has to be addressed. Because this, in no time, it will go into grade 3. Understand? Go lined up in cirrhosis. As I was telling, a lot of alcoholic also, as an Indian, it also causes cirrhosis, micronodular cirrhosis. Along with it, if weight gain is also combined, it will become a deadly combination. That is one thing. And so many patients who are BMR is low, whatever they do, they may not lose weight much. To be very frank, if the BMR is good, I'll still say yes, go. Go ahead and try something for yourself, like diet, exercise, whatever you want to try. Please try. For example, some people lose gain. So this is very, very common because our body is set into a fat set point. For example, I am 80 kgs. My fat set point is around 80. So what happens is, I lose some weight in Ramzan fasting. I may lose some 4 kgs, 5 kgs, become 76. Before Bakrid, I'm back. Bakrid is 2 months after Ramzan. So within 2 months, I'm back. I lost 4 kgs, but because my fat set point is 80. Understand, right? So people who are very obese, the fat set point is deranged.
I see.
There is no control on the fat set point. My fat set point is controlling it. For obese patient, there is no control. So that's the reason they become 100, 120, 150. It's deranged. One of the reasons for derangement is multiple weight loss attempts are also. For example, if I'm 80, if I become 100 in 2 years, for example, if I do too many attempts, that 20 kgs, if I have to gain the 20 kgs in 2 years, I'll gain 6 months only. Because I'm repeatedly doing too many attempts, which I'm not consistent. I may do for 3 months, leave it. I may do for 1 month, I leave. In this way, I'm disturbing my fat set point.
Wow. So if someone is listening to this podcast and let's say that they are in the weight loss journey and they have attempted a couple of times and they come to you, and based on what I understood, you check the BMR. If the BMR is low, let's say like 1000 or 1200, you have an idea that that patient should do even more to increase the BMR and then lose weight. It's going to be a big issue.
Yes, Herculean task for them. See, what happens is, For a women, we don't have much. They don't have much muscle and bone weight. Men has more muscle and bone weight. So if the men BMR is slightly low, we can slightly tell them 200, 200 calories. We can still tell them, please do something else. For a women, it is not difficult. It's not easy, even though they are trying from themselves. So many patients who walk into my OPD, they say, sir, we don't eat much. We eat very less. Because there is a column called dietary habits. I always ask them, how much quantity you eat? Sir, I eat less. I skip meals. How they are gaining? Because the BMR is so low. And they have, along with it, they have PCOS, they have hypothyroidism, they have cortisol issues, they have sleep issues, even sleep. Sleep is very important.
Lack of sleep causes weight gain.
Yeah, obviously. So lack of sleep causes weight gain. And even stress. Stress will release a lot of catecholamines and all this corticosteroids. So what happens is that in turn will cause weight gain. So the steroid hormone, which inbuilt steroid hormone I'm talking about, will cause weight gain. So in this way, a lot of things which is lowering your metabolism.
So when we talk about this to the patients, they always are scared of surgery.
Correct.
Can you educate the audience what is bariatric surgery?
Yeah. See, if you really see, Barros, the word, Barros means overweight. Surgery. Any surgery for overweight. If you really say overweight is a small term, obesity. Any surgery for obesity is bariatric surgery. So what happens is, nowadays we are not calling it as a bariatric surgery, we're calling it as a metabolic surgery. Because your metabolism is getting corrected. Your diabetes is getting corrected, your blood pressure is getting corrected, your cholesterol, PCOS, hypothyroidism. So many health issues are getting corrected. So that's the reason we call it as a metabolic surgery. It's good to call as a metabolic surgery than bariatric surgery, to be very frank. This is a correct word.
Metabolic surgery. And to a layman, how do you explain what do you do?
Yeah. So what happens is, what we do is we put a small holes on the tummy. Small holes, like a camera, we put a camera, laparoscopic technique basically. We go and reduce the size of the stomach, join with the intestine. So basically what happens, now before the food quantity was very high, now it becomes small, but instead of eating 3 times, you can eat 4 to 5 times, small quantity. Number 2, the hunger cravings will come down. And number 3, satiety will increase. Like for example, even if you eat less, you feel full. And number 4, the hormonal changes which will happen after surgery, which will melt fat from everywhere.
And how long does this take?
It takes around 8 to 10 months.
8 to 10 months. And how much weight one can lose?
So it depends on how much excess they are. So those around 80% of excess weight. For example, I should be around 80. If I'm 140, I'm 60 kgs excess. Out of the 60, I may lose around 45.
45 kilos.
Yes. We have patients, for example, we operated a Bangladesh patient who was 240 kg. He's 101 now. He lost 140 kgs. So how much depends. Weight loss is different for different people. I want to say that. If you are more, you may lose more.
But this is not, somebody shouldn't think this as, okay, I got my weight loss surgery, I can eat whatever I want.
So, whatever we may do, you should also have some discipline in your life. For example, you should be away from the calories. You should have a habit of walking 1 hour per day. You should be bold and frank to say no to calories. Like calories means sugary items, sugary bakery items you should avoid. Cola, Pepsi you should avoid. Rest of the thing, rice and everything you can eat, non-veg and all the stuff you can eat. That's not an issue.
And people usually, sometimes they do gain the weight back after surgery. Right?
Yeah.
Why does that happen?
Some people lose because what happens, post-surgery, the follow-up is very important. When I do surgery, you should always come for follow-up. Every 3 months follow-up is important because if you're doing a small mistakes, I can correct them then and there itself. So lack of follow-ups, what happens is they start eating too much of solid food which stretches your stomach. So I want them to eat soft food, chew well, and keep a habit of walking and all the stuff, and avoid solid food as much as possible. Keep it a soft food and all. If you keep a habit of eating soft food, chewing well, the chance of gaining back is very, very less.
Very less.